Well, we always knew that we might see local lockdowns in response to local outbreaks. We've seen it in other areas of Europe, for example. And Boris Johnson has spoken of a whack-a-mole strategy. But anyone who knows that game knows you have to be quick, and that doesn't appear to have happened here. There's something of a political row that's broken out because elected officials in Leicester say that the government has taken too long to communicate with them, and they haven't explained fully the numbers of cases that we're seeing and where exactly these are. As if to illustrate that point, we had been expecting an announcement from Matt Hancock in the Commons at 5 p.m. We're now told this won't happen until around 9 p.m. And we've been briefed that it's because more meetings will have to be held with more senior ministers, which does suggest that there will be an announcement about some sort of extended lockdown. But we still don't know how this will work. For example, will they just shut down particular schools or factories where there have been outbreaks? That's already happened here in this city. And we don't know officially the areas that have been affected, but we've learned that 2 of the areas happen to be predominantly South Asian, and the cases involve younger people of working age. Now, the government's played down suggestions that they might set up roadblocks in and out of these areas to prevent people going in. But people have been saying, well, if not that, then how will you police it? Will businesses in those areas be compensated? There's been a lot of speculation, and many people here have been left angry and frightened, as I've been finding out today. This morning in the heart of Leicester, they were installing a new socially distanced one-way system. 5,000 new bollards to help people keep 2 metres apart. Just as the rest of the country is looking forward to coming out of lockdown, residents here woke up to news that they may see it extended for another 2 weeks.
We are concerned about Leicester. We are not out of the woods yet.
Rikesh Kotecha has run a takeaway here for 30 years. He's critical about the way news of the lockdown has been communicated. Like others, he had no idea what the bollards were supposed to be for. And they hadn't actually told you that it was supposed to be because of COVID?
No, I actually found out by asking one of the traffic wardens.
Mr. Kotecha says health messages aren't getting through to some of his customers.
In this area, I think communication had to be in Gujarati, maybe Hindi, Punjabi, had to diversify in this area, I'm afraid. And I think everything was in English. And I think that could have been a major problem.
Throughout the day, people queued up at this testing centre in Spinney Hill. It's one of 4 that have been set up in the city after a spike in cases. There have been nearly 900 positive tests in the last 2 weeks. This may seem small, but it represents a third of all cases in the city since the pandemic began. And yet hospital admissions haven't gone up, neither have deaths, leading the city's mayor to question the need for an extended lockdown. He was only officially told about the plans this morning in an email sent at 1 a.m.
It is very likely, insofar as anybody can tell, that the reason you're getting more positive cases is because you're doing more testing.
So you don't think there's been an actual spike? You think it's because of the testing?
There may be. There may have been a spike, but they certainly haven't shown us any evidence.
We've confirmed that this is one of 2 neighbouring postcode areas that's seen a rise in the number of cases testing positive. It's predominantly South Asian, but the data that was passed to the City Council doesn't give a breakdown by ethnicity. And public health officials tell us that this data is vital if they're to understand the outbreak and target health messages towards specific communities. There's been much speculation as to why the outbreaks have occurred here, with some pointing to high numbers of multi-generational families, often living in poor housing in deprived areas. But the focus on minority ethnic communities and the establishment of testing centres in these areas have been criticised by some.
We've not had a corona death in our area for the last 3 weeks.
When the outbreak began, Ahmed Kasu organised a team of volunteers at his local mosque to carry out burials. At its height back in April, he was dealing with dozens of deaths every week. But he hasn't been called out, he says, in the last 3 weeks.
The majority of people have been following the guidelines. Ourselves, we were told that, we don't celebrate on Eid. The majority of people have abided by this. They didn't celebrate Eid, they didn't go to visit their families. We've been following, I believe, the rules and the guidelines that the government have set down. But then to have the label that it's in our area, this predominantly Asian area, and that the Asians are not following this, I think this is totally wrong. I don't agree with that at all.
Tonight, there is still no clarity for residents here about what a local lockdown will look like. An announcement by the Health Secretary has been delayed until after 9 p.m.
Well, our health and social care editor, Victoria Macdonald, joins us now from the newsroom. Victoria.
Well, Kathy, you may be surprised to hear me say that in one way, this is a system that is actually working, given the amount of confusion that surrounds this. It is working because we were able to see the regional data, and it was Public Health England who were able to alert officials in Leicester. But from there, it goes slightly awry, because what we see, as Darshna said in her package, was there was a complete lack of granular data that would help them. They didn't get through the reports, they said, until at least last Thursday, some of the reports that did not say, for instance, what the ethnicity issues were, what the age issues were. Some regions are still talking about not getting postcode, getting at a postcode level or street level, so that they can actually go and find the centre, the heart of these outbreaks. Now, again, as Darshna said, we knew this was coming, so it begs a lot of questions tonight, not least what is the legislation, or whether there needs to be any legislation over how you keep one city away from what the rest of the country is doing, in effect, and keeping them in some sort of lockdown. At another level, public health experts that we've spoken to across the country over the past few weeks say that although the system is getting better, right up until now, they have been hampered by this lack of detail, and they need the system to work much, much better for what we know, when we know there will be other outbreaks coming. This is not going to be a one-off.
Victoria Macdonald. Well, now, earlier I spoke to Devi Sridhar, Professor of Global Public Health at Edinburgh University, and Steve Reicher, Professor of Social Psychology at the University of St Andrews. Both advised the Scottish Government on its response to Covid-19. And Steve Reicher also advises the UK Government on its handling of the pandemic. I started by asking Devi Sridhar if what has happened in Leicester surprised her.
Well, no, it doesn't surprise me, because we've seen from the recent ONS survey that there's still quite a lot of virus circulating in England. And so, sadly, I think having local lockdowns is a glimpse into the future and the lockdown and release cycles that might be coming as we head into winter especially.
Stephen Reicher, it is extraordinary that we're speaking to you on a night when Scotland is celebrating 4 days without any new cases. And England is boasting of a city that is now having to slow down on unlocking because they've got so many new cases.
Extraordinary, but I don't think it's surprising for a number of reasons. I mean, first of all, at the point when it was announced that pubs would open and social distancing would be abolished, in effect, a message was sent saying back to normal, despite the fact that Chief Medical Officer Chris Whitty pleaded with people not to take that message. That's the message people got, and that's the message people will get every time they see people in a pub, not distanced. So the danger is that in the midst of a deadly pandemic, where adherence to restrictions is important to save lives, what's happening is sending out precisely the wrong message. And so in Scotland, I think a much more cautious approach is being taken, in the aim not of maintaining lockdown, but ending it as soon as possible. And I think what we're seeing is the old adage that slow and cautious wins the race.
Devi Sridhar, can local lockdowns work?
Well, it depends how they're implemented. I think, one danger, and we've seen this in the past with local lockdowns, is you have a fleeing of people from the place that's being locked down out of that area and spreading the infection with them. And so I think local lockdowns have to be approached very cautiously, and you also have to have the buy-in of the local community. And I think one of the problems here that we've already seen is a disconnect between what is being said in London and actually what's being said in Leicester itself, and actually people there not feeling like they've been involved in that decision.
And how damaging, Professor Sridhar, do you think the developments are tonight?
Well, I think it just comes back to what Steve is saying, that, slow and steady. I think Scotland set out a strategy, which is that you're trying to get to zero COVID. You're trying to push this virus to the margins of society, because that's how you get schools open. That's how you get those who are shielding out so they can be circulating and interacting with the rest of society. And that's how you get actually normality back, is through suppressing the virus to a level where your testing and tracing can do the work. And I think what we've seen in England is they lifted lockdown restrictions probably back in May, just way too early, instead of using the time to build up the testing and tracing. And so sadly, I think that we're going to be seeing more lockdowns in the future, especially as pubs and indoor locations open, given we know how the virus transmits indoors.
What effect do you think the makeup of the city of Leicester, which is after all majority ethnic minority, if I can put it that way, I mean essentially Asian, does that have any clues as to what's gone wrong? Stephen Raisha.
The inequities and inequalities that are playing out in Leicester aren't simply those of ethnicity. They're also those of age and they're those of class. At the moment, we're seeing a situation where the people who've been most affected by this pandemic are people who are poor, are young people, and people from ethnic minorities. And unless we address those inequities, in particular the generational inequity. So young people have made an amazing sacrifice in adhering to lockdown. They weren't at much risk, but at the same time, they were prepared to lock down for the community as a whole. But now we see that of those who are going to pay for the coming recession, it's going to be young people more than ever. And unless we put those issues of inequities on the agenda right now, we're going to see resentment. And so the issue of dealing with inequity, as I say, of age, of class, of ethnicity, isn't a luxury. It's something we have to do to keep the population together to adhere to the necessary measures. That's the priority I think this government should have.
Devi Sridhar, I'm bound to press you then, as you live and work in Edinburgh. What has Scotland got right?
I would point to three things. The first would be that we had a lockdown that lasted longer. We were generally 2 to 3 weeks behind, so we still have the stay-at-home message. Most people cannot travel more than 5 miles outside of where they live. The second was going immediately for local tracing and not relying on an app, using local public health boards. And the third is trust in government. There's very high level of trust in government and compliance with the measures, and that's what I've been quite amazed about in Scotland, that most people, the majority of people, even young people, are adhering to the message.
Devi Sridhar, Stephen Raisha, thank you very, very much for talking with us. Thank you.